change in the region that could make a generational difference to the life chances of our residents. And our ambition is clearly defined within our strategic economic plan, Making Our Mark. And if you haven't seen that document, I suggest that you do look at it and you'll see exactly what our ambitions are. This is the document which frames our strategy for growth and which has been created with the support of all the sectors represented within the combined authority. That is local government, the local enterprise partnerships, there are 3 of those, higher and further education, the private sector and a range of other organisations, both statutory and non. Our ambition now starting to be delivered is for more jobs and investment, better skills, an uplift in productivity to around 5% beyond the national average, and the ambition to close the £4 billion gap between tax and spend. And that will all make us financially more self-sufficient. We recognise that those are bold numbers, but we've committed through that partnership to delivering on those programmes to close those gaps. We see the momentum is with us. Coventry will be the UK City of Culture in 2021. Birmingham will host the Commonwealth Games in 2022. And our recent devolution deal has brought us more money for the Automotive Technology Centre. And clearly the Mayor works on a daily basis to attract that foreign direct investment and inward investment into the West Midlands and the wider West Midlands, as I've said, for the benefit of everyone here. And I think, as you will have seen from the recent press coverage, he's trying to get Channel 4 to come to our region. When HS2 is being delivered as a key part of our strategy, and it is actually being delivered now, as with the HS2 board yesterday, and they've already applied contracts of around about £8 billion, regardless of what Carillion's position will be. It will deliver connectivity for the region like never before, and actually will be a catalyst for growth both regionally and nationally across many sectors, which we need to take advantage for our population here in the West Midlands. We're clear about our ambitions for growth, and we believe that many of the foundations for that growth are already in place. Equally, and I think very important to all of you here, we are clear that growth is not at any cost. We want that growth to be an inclusive growth, that our residents can touch and see, and which means something to them. Growth which makes a real difference to those families, communities and places within the region who are looking to us to succeed. The relationship between health and wealth is a critical determinant of the inclusive growth that we want to see for the West Midlands. As a combined authority, we've argued that health and wealth are indeed 2 sides of the same coin. And those of you who've heard us speak before with regard to the creation of the combined authority, that is very much the mantra that we've delivered. It is actually 2 sides of the same coin. We're clear that a healthy population is a more productive one, and a wealthy West Midlands will be a healthier one. We've been bold about the need to measure progress against these goals, and with the support from our public health colleagues, many are in the room today, have embedded key health and well-being measures within that economic plan, Making Our Mark. From the evidence, we know that people's ability to contribute to their society and economy means doing more to address the fundamental barriers that many of them face. The evidence we suggest that across the West Midlands we do have some key challenges. We're the youngest region outside London, but our young people do less well than both the London and national averages on many health-related outcomes. Our education attainment figures and levels of needs suggest that many of the region's young people will find the transition to a healthy, productive adulthood something of a challenge. Our all-age disability figures show that the average age at which a man will have a significant disability is below retirement age, with major impact on loss of skills and expertise for the jobs market. This is compounded by the fact that we do less well than other parts of the country at keeping disabled people within the workforce. healthy life expectancy across the region actually is only 60 years of age. We have a gap between healthy life expectancy and life expectancy of over 20 years. This means our older people will have considerable health and social care needs for many years, and which will create many demands on our services. And as a politician, or the politicians in this room in local government, we face those challenges every year to decide how we're going to meet the demand, how we're going to deal with the gap, and how we're going to close it. Progress against these challenges will not happen without a step change in collaboration across places, agencies and sectors of the economy. There is no magic wand which will close our gap between supply and demand. Therefore, as the population changes, we will need to be much more creative in recognising the links between health, between transport, housing, digital and other sectors of our rapidly transforming Midlands economy. Which is why our Public Service Reform Programme and our Wellbeing Board, which I chair, has set out clear priorities, emphasising the need for joint working and the enabling role that the combined authority and the Mayor Office can play is important in that. Let me be a little bit more specific about two of our key priorities and some of our programmes. Thrive. This is our major programme of work supporting mental health and well-being, which was developed through the Mental Health Commission chaired by Norman Lamb. We've started by focusing on three areas in the programme. Employment, focusing on how we help people with health problems into work by piloting industrial placement support schemes, and how we create the right incentives for employers to improve workplace well-being approaches across the region. Housing. The West Midlands will be one of three pilots, both for Housing First, and the Chancellor announced that fund, and we're now working with other partners to actually tap into that. But equally, the Housing Investment Fund, which is being negotiated as we speak with governments, and we would hope to have some announcements fairly soon on what the West Midlands can expect to receive within that fund. This is a model, Housing First, in which people with mental health problems have their housing needs met as a matter of priority, and in return are offered enhanced support to help them improve their lives. Criminal justice, improving support for people with mental health problems in the criminal justice system. This includes the Criminal Justice Engager programme, providing psychological support to prisoners leaving prison to help them mentally well. Then the second priority is West Midlands on the move. This is our strategy for showing how physical activity can contribute to improved well-being and prosperity, both physical and mental, within the region. And we're a critical part of achieving our ambitions for the Commonwealth Games legacy that bridges the health and wealth divide. Here we are, the focus on three priorities. Improving the urban environment. This means building health into the design and delivery of housing and transport schemes. This could be through actions such as creating more active travel opportunities, developing a cycle share scheme, and influence the regeneration of urban space to encourage activity and healthy ageing. Then by using the creative and digital opportunities. The West Midlands is a leader in this area, and we encourage digital schemes that enables mass participation of people to adopt a more active lifestyle, working closely with Transport for West Midlands. And this pursues the goal of a more integrated transport network. And some of you may have seen some of the programmes that Transport for West Midlands are coming out with regard to digital creativity and opportunities. Third is the key challenge for us of improving community involvement. We recognise the strengths we already have in our communities and the opportunities to build on this by supporting voluntary organisations and community groups to get local people active. The Mayor is also keen to address physical activity inequalities among women and the disabled. We've recently held a round table with Disability and Sports Group to scope some of this work. In conclusion, I want to say a word about our role and the commitment I want to make for the combined authority in supporting a more substantial relationship between health and wealth in the future. A sustainable long-term relationship between health and wealth means going beyond programmes of work or particular strategies, however excellent they may be. And therefore, this afternoon I'm going to make 3 pledges on behalf of the Combined Authority and on behalf of the Mayor. First, to promote health and social value across everything we do, from addressing social isolation to the transport network, to encouraging construction companies to support employee well-being. We have a huge opportunity to create a culture of health in all policies and in procurement, in fairness. And the West Midlands Combined Authority should lead in doing that work. Second, to champion better health outcomes for the population, using the Mayor's convening powers and ability to influence, persuade and champion the right things across the region. We can't change public services overnight, but the WMCA can play a key role in promoting and enabling progress across the region and supporting those who can make a difference on the ground. Third is to use devolution as a driving force. We're in the early stages of devolved government in the English regions, but it is a process which we actually are engaged in on a daily basis. One of the things the Combined Authority has been able to do is to get behind those doors in government and to talk to those ministers to make sure they understand what our priorities are. But the potential for a more joined-up approach to health and well-being is clear, and the post-Brexit landscape will only create more uncertainty for the model of public services that we have become used to. Our pledge is to do everything we can to make sure this works for the West Midlands, and that we're strongly making the case, as I've said, to government. It's a journey we can't make on our own. I therefore hope you will support us in our ambition, in our journey, and let's together hopefully strive for the success I've laid out for you this afternoon. Thank you.